Hello, I'm Andrew Flint. I'm a radiographer at Kingsmill Hospital. I'm going to speak to you about radiography today. The main part of radiography is being included in the patient diagnosis, so it's a very, very rewarding job. Radiography is a 3-year degree. It's similar to nursing, patient care. The main things about being a radiographer is the biology side about it, human anatomy and stuff like that, learn about all the different types of fractures and pathologies there is. Also there's the physics side of it, so learning how an X-ray is created, how it creates an image and then therefore helps the patient's diagnosis. The reason I applied for the job at Kingsmill was because I was a student here for 2 of the 3 years of my degree. So I learned a lot whilst here. I enjoyed the place and I could see myself being a radiographer here. During my role as a radiographer, I have learned so many different skills, communication skills, patient care skills, even simple stuff like using a computer, makes you very computer literate. It doesn't matter who you're speaking to, whether it's a doctor or a patient, everyone's on the same ground and everyone has a mutual respect for each other. Whilst working as a radiographer at Kingsmill, I have had immense support from my management, always trying to push you forward, make you strive, do different courses to push you and broaden your knowledge. There's many different courses from image interpretation to communication, any sorts of cannulation training. As long as you speak to my management, they would help me. As a Band 5 radiographer, you do many different things. There's different modalities to go into. So you've got X-ray, which is your main study, of course, and then you've got CT, which is a broadened horizon of X-rays to get more in-depth images. We guide surgeons in theatre, which is helping them get screws in place, etc. We do barium swallows and bladder pressures in fluoroscopy. There is ERCPs, so that's a different modality, all different things we learn as a Band 5 radiographer, which keeps the job very interesting and gives you a lot of knowledge. One of the main things at Kingsmill Hospital was the fact that as a Band 5 radiographer you do go into CT, which is not very common as a Band 5. You normally have to get a Band 6 post, which then allows you to go into CT, whereas it's part of our training for on-calls, so overnight shifts and stuff, we cover CT. All the examinations overnight. As some proof from my management, I have been given the opportunity to do a CT head reporting course, which is going to broaden my anatomy of the CT head, especially when it comes to on nights and stuff. Obviously it will be reported by radiologists, but it gives me a broadened look and makes me understand it a lot more. As with all jobs, it is very challenging. There are always hurdles, but the NHS is very supportive, so there's always someone to talk to, whether it's about any sort of mental health regarding your work, or if you're just not grasping something, you can get time to focus with people who are above you, and they'll help you and push you, and then you will get it, and it's extremely rewarding, especially when you learn new skills, etc. Just a brief part on COVID-19. So every patient that comes through the hospital has to have a chest X-ray if the doctors think there is a chance of COVID-19. So we have to use all PPE, everything like that. And radiography is quite a forgotten allied health profession. So not many people know that we do go through all the same stuff that nurses and everyone else does. To cover obviously ourselves and the patient and prevent the spread of COVID-19. So it wouldn't be just COVID patients that came through A&E. We would have to go to the wards for patients who were admitted with COVID-19 to do mobile chest X-rays. So we'd have to take the mobile machine, then we would go visit them, of course, with all the right procedures, which Kingsmill have dealt with extremely well. Always on hand with PPE, always the support we needed if there's any questions. Infection control has been on top of it, it's been great. We go to ITU, so when all the patients are intubated, all the nursing staff have been great to help when we're doing chest X-rays. At the peak of the pandemic, we had to wear a lot of PPE and a lot of cleaning, so this has changed a simple chest X-ray, which can take 2 to 3 minutes, into like a 20-minute X-ray. So as you can imagine, the demand for X-rays increased, and so did the time to do these X-rays. So everyone in the radiology department was working extremely hard. People were drafted in from everywhere, but as a management dealt with it incredibly well. And 95% of patients that come through the hospital will see a radiographer at some point for some sort of diagnosis or to rule out a diagnosis. This is extremely important, and the profession is growing a lot. As a Band 5 radiographer, you can speak to management and then they can give you time in different modalities such as MRI, ultrasound, nuclear medicine, CT. All of these are a master's degree if you want to do them full time. So you can get rotated time in there, working as a Band 5 radiographer, just to get an insight to find out which avenue you want to take as a radiographer and to push your career along. I've taken a keen liking into CT, so I've been putting myself out there, trying to get as many shifts in CT as I can, doing overtime, helping out the team, and it's come across as if I'm interested. So management have seen that, and they are happy to fund this course, which has been funded by the NHS. So I'm going to broaden my horizons, and eventually, hopefully, I'll be working as a Band 6 in CT in the long run. If you're thinking of a career in the NHS or as a radiographer, then you've got to be prepared to work hard. But the harder you work, the more rewarding your job will be, as you'll be helping more people. So to do a degree in radiography, you need your basic GCSEs, so obviously 5 A's to C's, and then you need 1 based in science. That would push you into your A-levels. Then once you've got your A-levels, 1 being in science, then you do a degree of diagnostic radiography. I did mine at Sheffield, and it was amazing. A lot of placement time, 50% placement time and 50% academic. So you learn at university and put it all into place in placement.